I'm Dr. Elizabeth Lourens. My patients know me as Lizette. I practice in Canmore, Alberta, a beautiful town in the Canadian Rockies. I have a background in anesthesiology and emergency medicine. I have a certification from the College of Canadian Family Physicians and have seen mostly women in my family practice for years. Only now also seeing their husbands since I've been doing anti-aging medicine. Anti-aging medicine has been very rewarding for me because I deal with health now. For years I've only dealt with disease as a conventionally trained physician, and now, although I still deal with disease and manage disease, I deal with health and I see people feeling healthier and having a better quality of life. Many of the people that have branched or progressed into this field of medicine have been emergency physicians, psychiatrists, internal medicine physicians for a long time. And they were all looking for some other tools rather than just conventional medicine to make patients better. And I felt that I had to go and do a specialist training in it to become as good as I could and help them through the maze of alternative, integrative medicine, diets, supplements, which is sometimes for patients overwhelming, even if they are very motivated to change their life. I live in a beautiful mountain town called Canmore. It is a destination for many people for skiing and hiking. It's a very healthy environment with clean air and lots of patients being very active. Lifestyle choice for me to live here rather than in a city. And for my patients that come here from out of town, it gives them the opportunity to come for a day or a few days, enjoy the healthy environment, get away from their stressful lives and focus on making a plan for better health for the future for them. The goal of this kind of consultation service and this medicine is to improve patients' quality of life. Some of them that come and see us are healthy, they eat well, they train, they just want to maintain their health as they age. We see people with chronic disease, we see people with just an hormonal imbalance, and the whole purpose of this would be to extend their health span. Not necessarily their lifespan, but their health span, in other words, their quality of life, by teaching them that there are different treatment modalities and lifestyle changes that you can do if you're motivated. People will start feeling some minor hormonal changes, usually in their 40s.
I'm a little concerned about my brain health right now because my memory's not as good as it used to be, and both my parents have a history of dementia. So is there anything I can do?
Well, first I will say memory lapses are not an inevitable consequence of aging, but often concrete evidence of some brain and or hormonal deficiencies, because 90% of all illnesses are connected to the brain. And we often see the domino effect of chronic illness starting in the brain. If you look back at the neurotransmitters, the stress in our lives, and the hormones, which 90% of them are produced in the brain. We can give you the tools to slow down and inevitably, hopefully, prevent the cognitive decline. That is not the case for everybody, but those are the complaints we hear from patients. Sleep, irritability, weight gain, and a lack of enjoyment of life. And that's the time when you should start thinking about it. This is not disease, it might not even be pre-disease, but it's easily rectifiable with some expert advice. You know, there's usually not such a big motivation to change your life or your lifestyle, even as a physician, until you get sick. So I had long hours of after-hour work throughout my career, and eventually my sleep was completely non-existing, I felt, and I gained 3 dress sizes in a summer. For a woman, that's a terrible thing, especially if you didn't even eat the ice cream to deserve it. And at that point I started looking for options and started also hearing more and more of my own patients as I became their demographic, complaining of those issues, and started looking for answers outside conventional medicine. The best use of a physician with these qualifications is as a consultant while maintaining a relationship with your primary caregiver. It is nice to hear patients come in and say, I feel myself again. I feel like when I was 30 again. I exercise, I sleep, I enjoy life. That is what we hear over and over. It has made conventional medicine, even for me, much more of a pleasure to practice. You can have all the properties and all the vehicles and all the vacations in the world, but if you are not healthy, you cannot enjoy any of that. It is more expensive to diagnose pre-disease. It is more challenging. It takes more expertise than conventional medicine usually has. But the treatment is much easier, involves often just hormones and natural supplements, and the results are easier to achieve, much more rewarding, with lifelong benefits.